Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from 4 Points by Sheraton right here in Hurlingham. Now listen to this. Hypertension is usually called silent killer. Why? Because many patients are unaware that they have the disease. And here's the thing, in Kenya, 50% of the patients are non-compliant to their medication. So is this a big problem when it comes to tackling hypertension? Well, we find out after this fact of the matter. Hypertension or elevated blood pressure is a serious medical condition that significantly increases the risk of heart, brain, kidney, and other diseases. Often called a silent killer, most people with hypertension are unaware of the problem because it has no warning signs or symptoms. However, eating a healthier diet with less salt, exercising regularly, and taking medication can help lower blood pressure.
Naitwa Musa Usiori Enjere. Nilianza kusikia dalili 1979. Niko sawa. Nilikuwa na sweat, tena nasikia kama bomu sinaisha. Mpaka wakati ikafika 2005 nikaenda Kenyatta. Lakini tena hawakugundua ni nini. Nikaenda Nairobi Hospital. Tena hawakunionyesha ni nini. 2011 ndio nilienda Metro. Nikapimwa, nikaambiwa nitakana wanichunguze kwa mwezi mmoja. Mpaka akakuja kugundua niko na sukari na pressure. Nilipewa madawa na ndio nilikuwa na meza kwa siku asubuhi na usiku. Niliambiwa sitakani nikule nyama na sikule chumvi, wingi sikunywe sukari. Sasa mboga natumia sina mafuta mingi. Naweza ambia mtu yuko na pressure, ile kitu natakana chunge sana ni ile familia anakaa nayo. Kama anajua huyu ni mkali, yeye arudi chini, asirudi kupandisha hasira na hawa. Kama unapenda vitu ya raha, hutakaa maisha. Kashauri hiyo ugonjwa ya wewe mwenyewe ndio unatakana ubembeleze. Bila hiyo unajua hutaweza kukaa.
Well, let's get to understand more about hypertension. And first, to help us drive the conversation, we have Dr. Gabala Moksen, who is a cardiologist at Mpisha Hospital. It's very good to see you once again, Dr. After a while. You've been well?
I'm fine, thank you, Winnie.
You're welcome. And of course, we also have Alan Gaithuma, who is a patient, of course, living with hypertension. How are you doing today, Alan?
Very well, thank you very much.
Thank you very much for coming by today. And Dr. Gabala, let's start with you. So when it comes to blood pressure, let's just get to understand what's normal, what's not.
If we talk about the normal blood pressure, which is ideal blood pressure, is 120/80. Anything above that, it will be called different than ideal blood pressure. So we have normal blood pressure and we have high normal blood pressure when it starts to approach 130 systolic and above 85 diastolic. It's called, it becomes a little bit deviated from the normal limit. If it goes even higher, above 140 to 160, that will be hypertension, a disease. And we have 3 different classes depending on the blood pressure. Let's say in average 140 to 160 systolic. If we only talk about systolic, it will be stage 1. And then above 160 to 180, stage 2. Above 180 upward, it will be stage 3, which is severe. So you can say mild hypertension, moderate hypertension, and severe hypertension.
Okay. Alan, you were diagnosed with hypertension in 2000.
Yes.
Right, so 22 years.
Yes.
But this goes way before 2000, right?
Yes. Yes. Before the year 2000, it was more like a topic matter that was in the background, that was being tracked by my primary care physicians at the time. And I was not under any treatment back in the 90s. But in the year 2000, it reached a point where the numbers, like Dr. Gabala was talking about, where I think I was probably the mild. And so my primary care physician at the time said, it's time we placed you under medical treatment for hypertension. So that started in the year 2000. And it's been a permanent part of my life thus far. But it's been under management, and it's gone through periods of getting worse and then getting better. Now, the last 5 years, it's been trending better with lifestyle choices and running, exercise.
So before the actual diagnosis, that is in 2000, before, how were you? Did you have like any symptoms? What was going on?
I have no recollection of any symptoms back in the 90s. The only reason I knew about hypertension, it was because of my regular medical checkups. So, you know, the doctor will tell you, oh, you have this, you have that. And one of those, you know, items was, this topic is, it's growing in importance, you know, so we're keeping this on the radar. And so I was aware that there was a topic called hypertension in my life. But I didn't take it seriously until that conversation in the year 2000.
Dr. Gabala, in terms of the different types, do we have, because you talked about mild, moderate, and severe, but other than that, do we have like different types of hypertension that we see around?
We have different classification because hypertension have been actually known as a medical disease for a long time. It started even from the beginning of the 19th century. Alan actually described that when you have high blood pressure, you have absolutely no symptoms. So it has to be detected by routine medical check, or if you go by yourself and buy a blood pressure machine and measure it and you see that it is above the normal limit, then it is hypertension. If you start to have symptoms of high blood pressure, that means that you have complication of the blood pressure, or we call it target organ damage. It could be in the eyes, it could be in the brain, in the heart, in the kidney, the liver. So those are the symptoms of complication, but not symptoms of high blood pressure per se. So if you go back again to the different types of the blood pressure, so there are two major types, primary and secondary. The primary means that it has no cause. We don't know the cause, and we call it essential hypertension as well. And the secondary, which is about only 5% of all the number of patients with hypertension, is only 5% that they have secondary, which is secondary to something else. Some other disease which can cause high blood pressure, like tumor in the thyroid, or overfunction of the thyroid, or different endocrine glands, high cortisol in the body, high aldosteronism, which is another hormone in the body. Those actually make a lot of sodium retention and the fluid retention, and then ultimately it will cause high blood pressure. Even some anatomical disturbance in the kidney, like polycystic kidney disease, which is not uncommon in Kenya, and it can cause deterioration of the kidney function and high blood pressure. A problem with the renal arteries is part of the secondary hypertension. But most of the cases that we meet in the hospital actually are primary.
So then again, aside from diseases or conditions that might cause hypertension, and the fact that there are instances where, you know, we do not know the cause, do we have like then triggers or risk factors for the same that might expose someone?
People who are obese, obesity is one of the very common risk factors. Smoking is a common risk factor. Physical inactivity, that patient not doing regular exercise, and people who use a lot of salty food, a lot of spicy food. So sodium, we know that sodium is very well connected to high blood pressure. And potassium, which is affecting the blood pressure on the opposite direction, that the people who tend to eat food with high sodium intake, they actually have low potassium intake. Potassium is the mineral which found in a lot of fruits like banana, apple. So if you eat a lot of food containing potassium, it will protect you against high blood pressure.
And so, Alan, for you, of course, this conversation started. And the first time the doctor said, listen, you have hypertension,
Yes.
and we need to do something about it.
Yes.
What was the first emotion that came to your mind? Were you scared? Were you a bit worried?
And at the time, I wasn't too worried until the doctor said, these numbers here indicate directly that your kidneys are being mechanically broken down. And we need to put you on medication. And so I quickly accepted, all right, let's do this.
Let's just do it.
Yeah, let's do it. Let's start now. And he actually gave me medication right there in the office. It was a state of high concern for me because when the doctor mentioned my kidneys, that the topic became personal.
Yeah.
And so we started immediately. And I've been on medication pretty much since then, except for a 2-year, there was about a year period around 2017, 2018. My physical fitness and was really good, and I'd lost quite a bit of weight. And the measurements, my hypertension measurements said, you don't need all this medicine. So we started removing the medication, reducing to a point where I actually was at 0 hypertension medicine for about a year.
Oh, wow.
So that was the high point.
Okay.
And then I slipped a little bit over the past couple of years. Obesity was a problem in the year 2000 and the years after. So that was, and I used to smoke. And so the first thing the doctor attacked was the smoking. That was the first thing that. So it took me a couple of years after that. I stopped in 2002, February of 2002. So he got that out of the picture. That improved the numbers. The obesity kept being a problem, but then I compensated with exercise and running, all kinds of things. There was this particular environment that I worked in that was very stressful, and I would forget to take my medicine. I'd forget to do different things, and so the hypertension medicine. I'm sorry, not the medicine. The machine that measures your blood pressure. It raised alarms. And then I noticed I was getting these blurry headaches all the time. So I went in immediately. I didn't waste time. And I was told, okay, your high blood pressure is off the charts. They put me on different medicine, into some sort of intervention that cut everything down. But it was temporary. I was supposed to go back onto...
and just get...
Yeah.
Wow. Okay. How about we take a break? But of course, when we come back, we'll want to pick from there.
Yes.
And also, Dr. Gabala, in terms of then how quickly does it progress from just being a mild form of hypertension all the way to severe? For example, a case of burst vessels, right? Or even the organs being attacked. So of course, all that is coming up after this short break. Stay with us. This is Health Diary. All right, welcome back. Glad you're still with us. This is Health Diary, and of course today is all about hypertension. Very, very important topic for all of us to discuss. And to help us with the conversation, we have Dr. Gabala Muksen, who is a cardiologist at MP Shah Hospital, as well as Alan Gaiduma, who again is a patient living with hypertension. And Dr. Gabala, how about we pick up from what Alan said, that at some point, of course, his vessels, blood vessels burst and he had to rush to the hospital. And the question is, how do you get there to the point where the pressure is too high that, you need medical attention?
So the problem with high blood pressure, that if you don't treat it for some time, it will be like a vicious circle. So the high blood pressure, it will generate more blood pressure until the arteries get very stiff and very solid, and it makes the blood pressure to go very high, like 250 systolic. At that point, anything can happen. So the same, like if you have a tube or a balloon and then you overinflate the balloon, it will burst. So the same happen if the blood capillaries burst in a critical position, like in the brain, it will cause brain bleed, and it can be very deadly. So to prevent that, what we call the hypertension urgency or emergency hypertension or hypertensive encephalopathy, there's a lot of definition for this severe high blood pressure. Of course, we have to motivate the patient, and that's one of the biggest problem, because as we mentioned, that the blood pressure has no symptoms. So you are talking to a young patient who has no symptoms, and you are telling him, take 3 medicines for the rest of your life. So of course it's a very difficult task to convince that person to take those 3 tablets or 2 tablets for the blood pressure for
the
every
rest of
day
their
for the
life.
rest of his life.
Yeah. Let's come back to you, Arlan. And you said you were doing very well. And this is immediately you were put on medication, you were doing very well, but at some point slipped up, right? So is that when you experienced the crisis where, of course, your blood vessels burst, or at what point did that happen?
Yeah, that happened probably about 3-4 years after I started treatment, and it was really job related, stress related. And, you know, the discipline of remembering, oh, take your medicine, you know, that slipped. And for me, like the doctor was saying that you know, blood pressure can increase, you know, fairly rapidly. For me, the increase can take place in a matter of hours. And that's measured where I can easily get past 200. So getting to a place where I had the medical emergency, that was a short period of time. That was probably within a couple of days. But once I was, you know, the problem was identified, that wasn't, you know, when was the last time you took your medicine, when oh yeah, I forgot. No, so once I started taking the medicine again, I got back on that bandwagon. Then everything was fine. Everything was, you know, I got out of the problem just almost as fast as I got into it. And so I remembered, okay, let's stay with this. Let's be disciplined. And also let's be a bit more serious about the lifestyle choices, you know, the exercise and I noticed as long as I followed those simple guidelines, things were fine.
So what exactly did you have to do, aside from, of course, you decided to do a bit of jogging, walking, any other thing that you had to, changes that you had to make?
A challenge for me in terms of diet was salt. I love salt. I don't lean toward sugar. If I go to a party and there's a birthday cake or something, I'm not going to miss it. Yeah. But I'll think about the potato chips or something, you know. Yes. So I'll go that direction. So I was told, no, salt, don't do salt. So that was a challenge because salt for me, it would already be in my mouth by the time I remembered I was not supposed to consume it. So that was a challenge.
So then what do you do? Because now you love salt, but now you can't take it.
So what happened was it became a cocktail of medicines. You know, let's try this combination, losartan, let's try something else. Let's try hydrochlorothiazide in this fashion, you know, different things. And we found a cocktail that worked for me. And then it also became a dosage thing. As my fitness improved, my health, you know, eating habits improved, all of that, the dosage would go down. Yeah. Taking the medicine is a daily reality for me. It's automatic. I don't think about it. I think for me, I made peace with the condition. So it's I don't even think about it. It just, you know, take a glass of water and I move on. And that's it. Yeah.
How quickly, first of all, does it move from just a mild case of hypertension to severe, and how bad can it get?
There's no time frame, but it all depends if you have like a problem or a chronic stress that we call. It can lift up the blood pressure in just one day, and sometimes it takes 1 month, sometimes it takes 1 year. But if you don't treat it and it comes to this emergency hypertension, then he has to be admitted, and we have to actually use intravenous drug to lower the blood pressure as soon as possible to prevent the complication.
And then very quickly, before I come back to Arlan, an aspect of pregnancy. Can it in one way or the other contribute to high blood pressure?
Yes, of course. Remember, we know that in pregnancy, by the third month, at the end of the first trimester, the blood volume increased by 40%. So it's more water in the body. That's why a lot of pregnant women, they get swelling of the legs because of the too much fluid. So this is a natural thing that God has made it for the woman, because she needs more blood volume, because now she's getting blood to the fetus and to herself. So that amount of blood volume, of course, in patient who used to have high blood pressure before pregnancy, she will continue to have high blood pressure during pregnancy as well. Women who have family history of high blood pressure, then they will have more tendency to have high blood pressure during pregnancy.
Yeah.
And then there is two major diseases that can affect the pregnant women. One of them is preeclampsia. Preeclampsia is a syndrome, actually. It affected the heart, affected the liver, and it affected the blood pressure.
And of course, I'll come back in terms of, so fine, so suppose a woman has had hypertension and then they become pregnant. What happens in terms of the management of this thing?
So first we have to think about her health.
Yes.
So her health is very important. Hypertension, if we don't treat it and we said, okay, we can just allow the blood pressure until she delivers, it can actually cause abortion and it can cause a problem for the fetus. We call it small for dates, like the fetus doesn't grow normally. Because the arteries in the placenta, you know, if you have a long balloon and then you inflate it, and then it get very tortuous and spiral. The same happens in the placenta. And the artery, instead of going straight forward, it start to go around and the circulation becomes sluggish.
Okay. Yes.
And the amount of nutrition and the blood going to the fetus decrease. Then that put even a lot of burden on the patient and on the fetus. So we have to start the treatment as soon as possible.
So Alan, managing the same, what would you say to people? And then I'm also curious about the cost aspect, because this is something that you have to be on, lifelong medication, right?
Yes. So first of all, quick comment about the managing the condition. I measure my blood twice a day, in the morning and in the evening.
Yeah.
So it's an active, management is active. And like you said, the motivation, that's important. So I participate actively in managing that. In terms of the cost, the drugs can be very expensive. For myself, here in Kenya, my insurance policy covers the drugs. But I'll give you an example. I've been to a couple private pharmacies in the area, and they've charged me, upwards of 10,000 shillings for 30 days worth of hypertension medication, right? So cost is an incredible barrier for people to have access to the medication. It can be prohibitive for people.
Dr. Gabala, as far as understanding, first of all, how costly it can be and how challenging it can be as well to adhere to medication every single day for the rest of your life.
Well, let me start with a very short comment, actually. Yes, I said 31% of the prevalence of high blood pressure in Kenya. But if we come to the number that actually have treatment of these 31%, you will be astonished. It is only 8% of the 31% who actually have a proper treatment or a treatment for high blood pressure. And of these 8%, only 4% that they have proper treatment, which means optimal blood pressure control. So the number of the patients who are optimally regulated, like Alan, is very, very few. Yeah.
Okay.
And to tackle that problem, of course, it is a big socio-economic problem in Kenya, even for the government. So we have to find a way to manufacture drugs locally in Kenya, that it will be cheaper to the patient and more effective to get it than to import the drugs from outside Kenya. We have to start to educate the patient about nutrition. We have to prevent adiposity or obesity, so we have to decrease the alcohol. I mean, the alcohol itself, it is per se, it's a big problem.
It's a very big problem.
So, and unfortunately, there are large number of patients in Kenya that they use a huge amount of alcohol.
Yeah. So
and
individual
that's
responsibility.
another problem too.
Yeah. Okay, so individual responsibility, but also the government has to devise ways just to make sure that people have access to treatment at an affordable price. So Dr. Gabala Maxen, cardiologist, Mpisha Hospital, as well as Alan Gaiduma, who is of course a patient living with hypertension, but you're doing well as far as management is concerned. So thank you very much for coming, both of you, and really helping us understand more as far as what hypertension is all about and what we need to do individually and as well as the government, in terms of just trying as much as possible to see the numbers reduce. Okay, so on that note, take a look at this health tip. I have here my baked fish fillet, whole brown rice, some vegetables, and these are spinach. This is a balanced plate for a diabetic person that you can choose to eat either for lunch or for dinner. Why brown rice? Full of fiber, from manganese, magnesiums, and there's absorption in the stomach takes a longer time. On the other hand, I have a plate as well. This is a more vegetarian if you don't feel like doing meat. I have my black beans stir fried with some pumpkins. These are spinach and whole wheat pumpkin chapati. You can either do this for lunch or for dinner. Also as well, whole grains are full of fiber. It takes longer time for digestion, so releasing your blood sugars slowly into your system. Well, according to statistics, only 8% of all Kenyans living with hypertension are on treatment. That is a very, very low number. And of course, we can all agree that so much more needs to be done to make sure that we have as many people who are living with hypertension on treatment, and that is by improving affordability and accessibility of the medications as well. So that marks it for the conversation today as far as hypertension is concerned, right here on Health Diary. But if you have any more questions, feel free to engage with us on our social media platforms. My name is Winnie Lubembe. A special thanks to 4 Points by Sheraton for hosting us today. And until next time, adios. Nimeketi katikati ya kiti. No, most of the time nabonga muketi. Really? Yeah, it's a problem. Well, according to statistics, only 8% of hypertensive, what? Hyper who?